Thank you for joining us for another issue of DermTube Daily Coverage from Maui Derm. With us today is Dr. Ted Rosen, who has given an update on infectious disease and dermatology. And it's always interesting to have Ted here to talk about some of the things that we may see from an infectious disease standpoint in general dermatology, and then some of the genital dermatology as well.
Based upon December 2014 reporting of STD statistics in the United States from the year 2013, so that's the most recent year we have. Not to put too much of a play on words, but the bottom line is that everything is worse. Syphilis is particularly bad. We have the highest number and the highest rate, 5.5 per 100,000 since the late 1990s. The most syphilitic states in the United States include Georgia, congratulations, California, and Louisiana. And among the most syphilitic cities are San Francisco. Pertinent to sexually transmitted diseases was a fascinating recent study about the use of condoms, where over 8,000 episodes of heterosexual intercourse, including the use of condoms, were studied. And it turns out that when the application of the condom was rushed, there's about a 2.5 times greater risk of the condom breaking or slipping or leaking, and a higher risk of sexually transmitted disease. So the message is, put it on slowly and enjoy it. There's a new drug for Leishmaniasis. Remember that this disease can be acquired in the United States. That's pretty rare. There are about 50 cases in the literature. But certainly it can be imported, particularly in Americans who go abroad to the Middle East, Central or South America for all sorts of reasons. Up until now, we've had thermotherapy or pentavalent antimonials as our two choices. There is a newly approved oral drug. It's miltefosine. It's a lecithin derivative. It's given at either 100 or 150 milligrams per day, the higher dose being over 45 kilograms. Comes as 50 milligram capsules. It's very effective for almost all species of Leishmaniasis, and its side effect profile is really pretty benign. Uncommon and mild elevations of creatinine, liver functions, a little bit of headache, a little bit of nausea perhaps, but this is a nice alternative and new agent for the treatment of Leishmaniasis. While we're on the subject of parasites, there's also a new treatment recently demonstrated for tungiasis, the gravid sand flea that burrows into the skin of someone who walks barefoot on the beach. You just pour some dimethicone in there, or a highly dimethicone-containing moisturizer, and that basically chokes the little suckers. And so they're easy to remove because they asphyxiate to death. Isn't that an interesting image? Remember MRSA? It has not gone away. It's very, very common. In fact, the World Health Organization divides the world up into 6 regions, and in 5 of those 6 regions, 50% or more of all staph isolates are methicillin resistant. A recent study in the United States looked at where can we get this? How will we keep this perpetuating in an individual or a family that has over and over MRSA infections? And they found a high degree of carriage on fomites, and in particular, the landline, if someone still has a landline, the bathroom toilet seat, so I guess we can catch something from the toilet seat, the toilet flusher, and the person's hairbrush. Less commonly, but also seen, include the kitchen faucet, the refrigerator door, and the television remote. So if someone's having difficulty with a patient who has multiple episodes of MRSA, think about cleaning that environment along with decolonizing the patient themselves.